Hello, everybody. This is Dr. Kashif Abdullah here. It is Monday, April 6th, 2020. I'm talking to you here from the San Jose Bay Area, and I am speaking to you about today's numbers regarding coronavirus. If anyone has any questions, you can ask questions here on YouTube. I'll say hello there on the comment section. Or if you want, you can send questions. You can direct message me. And there's also WhatsApp that people have been using. You can use that as well. But I'm here to answer any questions you may have. And if this is in the past, if you're watching this in the future, you can also ask me questions on the questions. I should be able to see them. I found a couple of interesting articles I want to discuss with you about. One is I'll start off from the just the overall sense of the global picture, how we're doing as the world and individual countries, and then I found a great website that the Canadians had in regards to tracking this spread and how various nations are comparing against each other. Sort of a little bit different than the COVID-19 website that John Hopkins offers. And then there's couple of news items. One that just popped in literally a minute ago regarding Boris Johnson. So let us switch screens here. Okay, 1 second. Give me a couple of seconds. All right, let's see now. All right, flip here, and then that should be it. I think you should be able to see the screen popping up right now. Today, again on Monday, April 6th, 2020, we have 1,324,907 some odd cases, according to this John Hopkins coronavirus COVID-19 website. And if you look here, you can see the total deaths, unfortunately, has now risen to 73,000, almost 74,000. And I always look at the daily increases. And so far today, it was sort of a better, the last number that we have from the 4th, that's 2 days ago, is a drop from that. So I don't know what today's numbers are. Of course, they're always coming. But there was, overall in the world, I don't know if there's a plateau or if this is going to keep going, but it's not rising. So that's good. If we look at the US is now 352,000 people of confirmed cases, and that is greater than Spain, Italy, and not yet Germany combined. But we are unfortunately maybe going to cross that at one point in the US. So the US has become the epicenter. There is 10,000 deaths, unfortunately, and the greatest number is 1/3 of those deaths are basically in the New York area, especially New York City. Very, very dangerous disease thus far. The US, if we look at the daily increase, we're seeing there was a slight drop, so that's encouraging. I don't know if this is a sustained drop, but we would have to see this for a couple of days if this is a sustained drop. So thus far, there's no increase, but we need to see more data. If we look at Spain, they have a more sustained drop. So it looks like they may have hit their peak last week and are now coming down. So Spain looks like they're beginning to control this pandemic for them. For Italy, if you look at Italy, they are also decreasing, and it looks like they have it under control too. I think Italy and Spain are beginning. Spain, just the beginning. Italy, there's sustained numbers, so that's good. We've seen a plateau, and it is beginning to drop. Germany is also plateauing and dropping. We need to see more data for that to say, but it looks like Germany and Italy and Spain are on their way. France, I don't know if this is a fluke or whatever this was, but we'll see. We know data. China, again, I don't believe the Chinese numbers. I don't really put that into account. And Iran, there looks like Iran is actually also beginning to control it. You're seeing a drop there. The United Kingdom, I actually there's a topic I want to discuss with you about the United Kingdom, but we're seeing an increasing number there, unfortunately. So the United Kingdom is separate from the rest of the Europe in that regard. Turkey is also increasing, but not exponentially. Switzerland is also doing a sustained drop. So it looks like the greater European continent is controlling this pandemic better than, say, others. Belgium, I don't really, up and down, maybe. Netherlands, it's plateauing. And the Canadians, there was a big jump. But I did want to show you one website about the Canadians. Austria is really nicely doing it. The Austrian, I would say, of Europe is doing the best. So they're really controlling it. Portugal, we're just seeing a drop, and then Brazil, we're also seeing a drop. So, we're seeing that this is still ongoing, and the U.S. is still the epicenter. And I wanted to share with you, actually, there's some questions I wanted to answer. Let's see. The questions stated that there was a question I have here saying, actually, regarding questions, let's see if there's any live stream questions. No, there's no live stream questions just yet. Okay, that's okay. But in regards to the questions, let's see. Is it risky to work out outdoors, going out for a run or bike rides, etc.? And then, so what's my opinion on this? Well, ideally you shouldn't go out as best you can. Now I understand that if you work out a lot, you want to go outside. If you can do it by yourself, or maybe with the people who live in your house, then you could do it, as long as you're not coming into contact with other people more than 6 feet. Or if you are just, say, hiking all by yourself in the woods, it's fine. Meaning, it's ideally, again, you should stay home. That's the best part. That's how social distancing works. You have to stay home. But if you really, really, really need to go out, then you can. If you're doing the woods by yourself, or just whoever's living in the house and no one has any issues, you could go out. Biking. There was this video about, I don't know, 2-3 months ago, that Arnold Schwarzenegger was saying, biking is a great thing to do. So if you want, you could bike that way. But ideally, it's best, especially right now, when we have yet to really cross over into its decline. We're what's called flattening the curve. We're still not there. If you have to go, okay, maybe. But frankly, it's better to stay home. There was a video 2 weeks ago or 3 weeks ago with Italian mayors complaining about, all of a sudden there's these athletes that came out of nowhere. Where were you people? All of a sudden now everyone's an athlete? And everyone has to go exercise outside? What is this? Where were you before this thing? So they were complaining with the populace to please stay home, trying to prevent it. So Italy is dropping down. So I would say if you really have to, I guess. But my opinion is actually stay home for now. Stay home, wait for this pandemic to get better, and then once, as in the numbers go down, and substantially down. Maybe like South Korea, if you can go to South Korea's numbers, those numbers are, I'll show you, let me just show you South Korea really quick. South Korea actually is falling. Where's South Korea? Here. We can do this as a world. You see that? They're high, and now they're really dropping to like 81 cases. I think the last data they have, 81 cases in a country of over, I don't know how many, maybe 20, 30, 40, 60 million people, and they're now to 81 cases. That's really good. You see that? So if the world could do South Korea, then maybe you could go outside, but I would say stay inside as best you can. Now, in regards to this, there's a website I found from the CBC News website, and it's comparing the coronavirus curve. And this is, of course, Canadian-centric, so it's going to sort of favor, it's not going to favor, but it's going to show Canadian news. But you don't have to show. So there's a graph here, country by country, comparing, wait 1 second, am I showing you, yes I am, okay. Country to country comparing coronavirus. So this is after the 100th case, they start comparing countries. Okay, And what they're doing is you don't have to even select Canada. Like you can deselect Canada and China, and you could say US. So this is the US curve of the number of cases per se, and let's compare it to South Korea. There's South Korea. See them, and this this is almost actually in a logarithmic. This scale is logarithmic, so it's not exactly, you have to pay attention to this. So this is a better way of showing the data through a logarithmic scale, and you're seeing that they have, compared to South Korea, the U.S. has not flattened the curve at all. And actually it's not the highest one of them all in the number of increases since the 100th case, 34th, the day after the 100th case. If you take the U.S., and now let's compare it to Italy, which is a really hard hit, right? The Italians are controlling their curve. You'll see they're flattening their curve. If you compare the U.S. to Germany, the Germans are flattening their curve as well. The French, let's compare the French. The French are really flattening the curve. And then here's Canada. Let's take off France. And so far the number of cases, the reason they stop is because the Canadians don't have more than, they have day 26. So this is day 26 in the 100th case. So the number is much less. So it stops dead because this is day 26. They don't seem to have so the Canadians were late, so that's why I guess why they're showing it. Anyway, this is more talking about flattening the curve, about why flattening the curve is so important, because you don't want to you don't want to overwhelm the healthcare system. And then this is a really good chart in the fact that, let me turn off Canada and the US. This is telling you what we want. Okay, so there's something that every country, and this is where the flattening the curve bit starts. So you want less than this. You see this curve right here? Again, logarithmic scale. And this is doubling every 2 days. So that means uncontrolled virus replication, just going haywire, just going crazy. No control, no nothing, okay? You want to be below this curve, and you want to be below this way. So if you're below these curves, like if your country is somewhere here, like this country, what is this country? I think that's South Korea. No? What country is this? Let's see. Oh, that must be China. No, that's not China. What country is that? No? That's UK? No. I don't know what country this is. Anyway, so if we compare the US again, let's use the US since we live here. Well, many of us live here. You'll see that it's not it's not uncontrolled, but it's controlling. Oops, sorry. Sorry. I didn't want that. I'm not sure why it's doing that. Anyway, let me disconnect that. There we go. So if you look here, the US is below uncontrolled. So they're doing something, right? But if we compare, say, I think one of the best ones was, of course, South Korea. So you'll see South Korea is dead stop. You see that? There is no, even if it's better than doubling every 4 days, I don't think it's doubling every God knows how many days. I don't think it's doubling at all. After maybe a month, 2 months, it'll double. But you notice it's below this curve. So you see this line right here? This line? South Korea is not even the same slope as this. It's not following this trajectory. It's flat, essentially. So South Korea's done it. Now, if we use China, again, the Chinese have said they flattened it. Again, I don't know. Maybe they have. But the Germans, they're like, here, we use the US as a comparison. So you'll see the Germans are better, getting better. Let's take off the Germans. Let's show the Italians since they were hit hardest. So the Italians and the Americans were basically neck and neck until right about here. The Italians start controlling it. And then if we compare Canada, let's take this and take the Italians out. So there's Canada. So Canada has now crossed under every 3 days. So Canada's beginning to control the curve as well. The US unfortunately needs to really ramp up this control. And that's sort of where I want to talk to some of the news articles. So recently in the news, there has been, the US president doesn't want to give away and then this is just, the US president does not want to give away personal equipment to countries like Canada or to the Latin countries because they want us to keep it just for the US. So the president has told that the 3M company that makes the N95 masks don't give them to anyone except the US. So the reason being is the U.S. is frankly the highest. It's the most uncontrolled country compared to the other countries in the world, the first world nation countries. It's just going haywire, and this is very, there he's likely catching a lot of political fallout from this, and he says this America First nonsense. So he's just basically doing America first, and the Canadians are scrambling, as are other nations, such as in Latin America, I would imagine, are also scrambling. And I noticed actually there was an article. I'm going to discuss with you about. Where is it? Oop, there we go. There was an article recently by that showed that coronavirus may have crossed into tigers somehow. Now we've never seen this, and my wife showed this to me at first, and I thought, who knows? But then I saw a whole bunch of news articles. I thought she showed me on Facebook, and I don't really take Facebook for. I really am skeptical of Facebook. But then I started seeing it other websites were also mentioning, news websites were also mentioning this, and I don't know if they have enough data, frankly, about is this a true transmission from human to animal? Like coronavirus is so bad because it went from animal to human. This is now showing human to animal. Now I don't know if this is in fact somehow this animal got it from a human. We don't know. And the real question then is, can this animal, like this tiger corona, if it's in a tiger, this is in the Bronx in New York, this happened. Could that be transmitted to other tigers? I don't know. And could it go to other humans? So there's a fortunate and unfortunate thing. Unfortunate thing is there's not that many tigers in this world. The fortunate thing is, again, there's not that many tigers in the world. So, but the thing is it possible that somehow corona could get into tigers but not other animals? Likely. Is it? I don't know. There's a lot of questions, but the question is, is my pet safe? Thus far, most of the scientists said yes, your pets don't get coronavirus, but with this tiger shoe, it just drives home the point of social distancing, because that's our way of doing herd immunity. And I also I was recently reading also in the news an article. Actually, I noticed I'm again from Canada, and I get a lot of Canadian news. I sort of keep up with their news because I have it on my phone. It's an app, and it mentioned, so Canada and the UK. Many of their stories are somewhat similar. Like, so if something happened in the UK, the Canadians will invariably report it at one point. And so it mentioned how Boris Johnson, and I guess the rest of the world would mention this too, but Boris Johnson came down with the coronavirus. That was okay. Then, just like Prince Charles. And then recently, about 2 days ago, it said that they had transferred Boris Johnson to the hospital from home as a precaution. And I got to thinking, well, the only reason someone would likely transfer someone from home to the hospital is because Boris Johnson must have been asked, are you having difficulty breathing? I think he must have been having difficulty breathing during this time at home. And they said, as a precaution, let's get you to the hospital. And just like a couple of minutes ago, or maybe 20 minutes ago, I got a news alert that said that Boris Johnson has now gone to the ICU. Usually, I can tell you as a physician why usually we will send a patient to the ICU. Usually, I would transfer a patient to the ICU if nursing care it's like every couple of hours, meaning the nurse will check in on you on the regular floors once every, I don't know, 2-3 hours. That's when they'll check on you. And they're just giving you medicines. You're being monitored, but you're not being monitored very closely. The reason someone would go from a home to a hospital or staying in a hospital would be because they need nursing care. They need a physician to prescribe something relatively quickly, like within a couple of hours. Now, if someone's issue or vital signs have to be monitored literally every hour, you can't do that on a regular nursing floor. It's too much work for a nurse. A nurse will usually have about 8 to 10 patients sometimes to take care of. Maybe a little bit less, 6 patients, depending on how good the hospital is. But many nurses have a lot of patients to take care of. They got to be they're really busy. They've got to make sure the medicines are getting in on time for every patient. They have to answer patients' needs. They have to speak to any new lab issues come up. The nurse has to maybe alert the doctors. The doctors are talking to the nurses. The nurses are dealing with other patients. It's just a whole bunch of stuff. So on a regular floor, about eight or so, 8 to 6 people. You'd have to. I'm not a nurse, but I know they cover a lot of people, so they can't have eyes always on a patient. In the ICU, when a person is transferred there, or a nurse will, like when I was a resident, nurse would ask me, Doctor Abdullah, oh, this patient, he is vomiting all the time. He is getting, it's difficult to breathe. His oxygen saturations are dropping. Um, and I think it's becoming too much, and not too much, basically too much. I think he needs ICU care. So I'd look into the patient, see how they're doing, what their vital signs are. Are they like vomiting blood? Are they coughing all the time? Are they difficulty breathing? It just maybe more. Do they need more ventilation support? So you don't have to be able to put on a respirator. You could put on something called BiPAP or CPAP. That's constant positive airway pressure. Anyway, some sort of help in breathing. And so, okay, I would transfer them to the ICU. And in the ICU, you basically have one nurse to every two patients. Usually, he or she would be sitting in one, like in a little pod, and there'll be a window to their left or their right, and they'll be monitoring that patient once they've been stabilized. So they come to the ICU, they'll hook them up to all the machines, all the various pumps, blood pressure, IV fluid pumps, if need be, medicines to help can regulate the blood pressure to make it up, and breathing apparatus and all that kind of stuff they'll do. And then they'll sort of sit and sort of do their charting. So they will literally chart every hour they're getting vital signs, every single hour, maybe every half hour, depending. I'm not a nurse again, but they're doing it very, very frequently. And when someone is on a ventilator, they have to be constantly monitored, and they have to constantly have monitors. So Boris Johnson likely was transferred to the ICU now because he needs more upper rest. He's likely, God forbid, maybe going to ARDS, acute respiratory distress syndrome. That's where the lungs get full of fluid. And in order for those lungs, so likely what it is a precaution right now is, okay, they said, listen, let's put him on a ventilator right now before it gets really bad, and let's prevent this issue from getting further out of hand. So there is a percentage of good lung, bad lung, and a ventilator can help support or prevent more of the lung getting filled with fluid and giving IV fluid, giving various steroids or what have you to control the inflammation. So likely they've likely put him on a ventilator already, only to help preserve his good lungs. And they're doing a whole bunch of other techniques. They're putting him upside down. They're doing a whole bunch of things. They're giving him fluids, or not giving him fluids, but removing. They're putting maybe suctioning, giving him what's it called again? Steroids, antibiotics, maybe. But they're treating him seriously. So this is a serious issue. So again, if I circle back to the first question about can you run? Yeah, you can run, but why put yourself at that risk right now? Why put yourself at for a little bit of exercise? You can hold off for a couple of months. You're not. The Olympics have been called off, guys. The Olympics have been called off for next year. I doubt you guys are Olympians. So I think you can. Let's see if there's any questions. Yeah, there's not questions yet. But I doubt you guys are Olympians, and frankly, I think you can stay home just for now. Wait for this curve to get better. And I was thinking in the bathroom, or just thinking, that's one. I was just thinking in general, when will this get all better? Or when will people feel good and comfortable? I honestly think people will feel comfortable when there's a vaccine. Like I would say, maybe, okay, let's just say July comes along, everything is fine and dandy, all the numbers have gone down, but people are going to feel scared even going out, I think, still. And maybe people will only feel right if maybe there's a vaccine. I hope they develop a vaccine soon for this. And I think by then people, and by then the disease will have either gone through all of us, and we will have likely created an antibody response, or we've controlled the disease and it's just gone from the system. Meaning, once you get the coronavirus and you successfully defeat it, you've removed it from your system, you've created antibodies, and so God forbid if you've seen the same strain of coronavirus, your body will say, I know what this is, let's kill it immediately. So the body will react immediately, but because you have likely gotten rid of it, you're not spreading it anymore. So what we're trying to do is we're trying to stop the spread of the coronavirus. And I would say once there's a vaccine available, we can greatly accelerate this. And I don't think this is like a year's problem. This is a big thing. And what we're all trying to prevent is 1918 Spanish flu epidemic, a pandemic. We're trying to prevent that. We're trying to prevent 65 million people from dying. So if we go back to the website, where to go? Let's go back here, here. So what we're trying to do is we're trying to prevent, let me show you. Let's see, this number from hitting 65 million. I don't think people understand what 65 million, well, maybe people, I would have said, assume do, but 65 million, think about that. That is a whole bunch more zeros after this. So that's like, let's see, 65 million, let's see, so 10 times is 700,000. Then 100 times would be 7 million. And then 1,000 times. So 65 million is about 1,000 times worse. So we don't want this to be 1,000 times worse. And we're doing it. If you, again, let's go back to these curves that the Canadian website showed, that we're beginning to control. Every nation, even the US, let's take off Canada again. Even the US is controlling the curve. So the US is not like, they were here. Look, if you see that, the curve, or that's the line, like compare this curve is if it's parallel to this curve. And you will notice about here, after the day 23 or so, there was an inflection point where the US is beginning to follow this doubling rate, right? This doubling rate. So what we want is to further change the slope of the curve. So there's a little bit of math right there. So what we want to do is flattening the curve or changing the slope of the curve in order to prevent increases. And if we're preventing increases, then we're preventing spread. So, and what we want is South Korea's numbers. We want like that, flat as a pancake. You see that? We don't want this. It's just not like what you'll see. It only increases by maybe a couple hundreds, whereas the U.S. is increasing like 50,000. Look, you see that? 50,000 in a day, whereas the South Koreans were doing what? I don't know. 70? Yeah, something like that. 70, 80 cases. Think about it. South Korea, 70, 80 cases increases in one day, and the U.S. is doing approximately 50 some odd thousand. No, sorry, no, maybe like 30 some odd, 40 some odd thousand cases. 40 some thousand cases versus 80. Think about that. So the U.S. needs a lot of work to do what South Korea did. I hope they do it, and I hope the whole world controls this insane problem, and we get out of this mess. Well, it's coming to the end of the hour, and let's see if there's any questions. I don't see any questions per se. It's the end of the hour. If anyone has any questions, they can direct message me. Thank you again for watching. I'll see you guys tomorrow again. Thank you. Bye-bye.